So I'm speaking today on behalf of myself and my teammate Barbara Stara in relation to a campaign that we ran across HEU this year, which was Period Promise, #NailTheStigma. So Period Promise was initially launched by HEU in March 2025. In its first year, the campaign delivered free, ethically sourced and sustainable period products across all 9 of our HEU campuses. So to date, over 220,000 free period products have been distributed, removing a significant financial burden to our campus population. However, at HEU, we recognise that supporting menstrual well-being means more than just providing free products. It's also about creating a campus culture where menstruation is talked about openly, respectfully and without shame. That's where Period Promise #NailTheStigma came in, a peer-led initiative designed to challenge stigma and normalise these conversations. So the project was developed by my classmate Barbara and I. It was designed as a peer-led response to menstrual stigma with support from lecturing staff, HEU Students' Union, our EDI team, our Healthy Campus Coordinator Yvonne, who's here today, HEU sports teams, Sligo Rovers and local businesses. Grounded in key health promotion principles, the initiative recognised that students are powerful agents of change, particularly when addressing sensitive or stigmatised topics. The focus of the project revolved around normalising conversations about menstruation, making menstrual health visible and inclusive, and engaging people of all genders, including those who don't menstruate. So from the outset, we wanted to design a campaign that made conversations accessible and engaging. It was essential that we included those who don't menstruate in these conversations, highlighting that menstrual health is not just an issue for those who do menstruate, but a community one. Collaboration with both male and female HEU sports teams helped to reinforce this message. Key activities of the campaign included a Nail the Stigma Day on our campus concourse, interactive activities such as perception mind mapping and product-based icebreakers like guess how many tampons are in the jar, use of campus screens with menstrual health information, a Period Promise quiz night with over 100 attendees, supported by volunteers and local businesses, and a targeted social media campaign. So this is one of our educational posts that we included on our social media. The impact of the initiative was both visible and measurable. In total, we directly engaged with over 300 students through on-campus events. We reached over 170,000 individuals. We reached over 170,000 individuals through our social media platform online. We increased awareness of free period products available throughout the HEU campuses. We encouraged open dialogue and reduced stigma, and we strengthened student confidence in peer-led health promotion. Evaluation focused on participation data, observations, and social media metrics, providing clear evidence of reach and engagement. Most importantly, the initiative supported a shift towards openness, dignity, and inclusion within the campus environment. Some key takeaways then from the campaign. So peer-led approaches work especially for sensitive topics. Students engaged more readily in informal and interactive spaces. A whole campus collaborative approach is essential. So early and meaningful partnerships with Students' Union, Healthy Campus, EDI and Student Services significantly increased reach and sustainability. The use of creative and inclusion engagement methods by combining in-person events with digital platforms amplified impact far beyond the physical campus. Partnering with HEU sports teams helped challenge assumptions about who menstrual health is for. Athletes became visible advocates, reinforcing that stigma reduction isn't just an issue for those who do menstruate, but a community issue. Tracking simple metrics then to evaluate provided evidence of reach and engagement. So finally then, campaigns like Period Promise are evidence that real change doesn't come from resources alone, but conversations, collaboration, and most importantly, the student voice. So when students lead that change, the impact goes far beyond the campaign itself. This campaign contributed to a shift in campus culture, moving from silence and stigma towards openness, inclusion, and dignity. Thank you.